leave because it's very late to
Yeah,
around
no
me.
problem. You can, whenever you are available, you can message me. No problem
Sure.
at all. Okay.
Yeah, thank you.
No problem. See, I will be available always from morning 8 o'clock till night till 2 o'clock. I'll be available. So whenever you are available, you can just
Leave
drop.
because it's very
Okay.
late to
Yeah, no
around me.
problem. You can, whenever you are available, you can. That's okay.
Mhm.
When you wake up, you can message me. No worries. Yeah, Dr. Mahwish. Yeah, you can start now.
Okay. Uh, Hi, I'm Dr. Tariq. I'm one of the physician working here today. May I confirm your name and age, please?
Yes, my name is Lincoln, Abraham Lincoln, and you can call me Lincoln. I am 42 years old.
Hi, Lincoln. I have your test results with me. Do you have any idea that like what uh, what we have today, or what kind of test we have done?
Yeah, of course, I am not sure. Can you give me a clarification, doctor? I need to know everything about it.
Sure, Lincoln. Actually, we have done your some tests last time, and so right now I have the report with me, and it shows that you have your the blood sugar levels are increased, which means that and it they are increased at two different occasions. So I mean that your two tests came positive for high blood sugar, and it means that you have diabetes mellitus.
Yeah,
Do you have any idea about diabetes? That what is
I
diabetes?
actually do not know anything. Is this the same as a sugar diabetes?
Um, yeah. So okay, let me tell you something. A brief introduction regarding diabetes. So yes, it's kind of same like a sugar diabetes. What happen actually in diabetes is we have a hormone in the body that is called insulin, and sometimes and it is secreted by a organ in the body in the abdomen that is called pancreas. So sometimes the pancreas gets tired with age, and the insulin gets very low in the body, or sometimes the body is not able to respond to the insulin. So what actually insulin does? It lowers the blood sugar levels. So when we don't have insulin, we have high blood sugar levels. This is what you are calling sugar diabetes. Um, did you get it?
Yeah, of
That what
course,
diabetes is?
doctor. Of
Mm-hmm.
course. I'm not
So
convinced of the diagnosis. Could that be right? I don't eat sugar or anything. I only did the two tests. Can you be sure? How is it possible
yeah.
that I have this diabetes?
I can understand that, Lincoln, and it's a very valid question. That sometimes people don't even eat sugar, and they say that they sometimes get the diabetes. So the thing is that not only sugars can cause diabetes. There are a lot of factors. Like there can be some genetic, some environmental factors, and some carbohydrates that we normally use in our diet. They are not sugars, but they are the form of sugar that we are eating in our diet, like rice, some white breads. So they can increase sugar levels in our body, and we think that we are not eating sugar. So this can be one of the cause of that as well. And regarding your question, that you said that two readings cannot say that you have diabetes mellitus. So regarding that, Lincoln, regarding it's by the World Health Organization that when we do these two glucose, when we check glucose at two different occasions, and if they came positive like high blood sugar, so then we call it diabetes mellitus. So it's not me, or it's not my lab. It's because the World Health Organization has set the standard for the diagnosis of diabetes. Are you with me?
Yeah, of course, doctor. I am with you. But the thing is, I don't believe the diagnosis. I'm not interested in all these things.
Mhm,
I am
mhm.
not interested to start your management plan, doctor. I don't want to control my blood sugar levels. I don't want anything. Because I'm not sure what you are talking. I don't understand. I'm not very clear. I'm not convinced. Yeah. Why don't you go for
So
something else?
yeah, so Lincoln, the thing is that even if you are not convinced or you don't want to treat yourself for that, I would definitely suggest you should go for that, because it is recommended that if you like, because there are what actually diabetes does, it affects different organs of our body, and it can cause complications, like it can block the arteries, the blood vessels, the to the heart, to the brain, and sometimes to feet as well. And there can be problems in the kidneys and in the eyes as well. So if I would definitely recommend that early, and not like it's recommended actually, that early treatment and regular appointments are very important for monitoring of the diabetes status. And I will be doing checking your blood sugar levels in every appointment, your blood pressure. I would be giving you a diary to keep your blood pressure levels, that record those, and whenever you will come to visit me, I will check that diary. And we will be keeping an eye on your cholesterol level as well, to prevent these complications. So are you with me, Mr. Lincoln?
Yeah, of course, doctor. But
And
the
there
thing
are
is,
some more.
I am not, whatever you say, I'm not convinced with all these things. I demand more tests. Why don't you go for one or two other tests and then afterwards confirm?
So, as I told you, that it's not me. It's recommended by the World Health Organization that we have that when the two tests came positive of high blood sugar levels, it means that it is diabetes mellitus. But uh, if you recommend that, if you are insisting, we can do, but I don't think so that it will change our diagnosis.
Right.
Yeah,
Okay,
but
doctor. In that
there
case,
are.
I'm not okay, but still, because you are insisting me, okay, I agree with you. Go ahead and now tell me what am I supposed to do?
Yeah, so there are a few things, LinkedIn, that we will work together and on. First of all, there is some dietary and lifestyle modification that we will work, and don't think. And I will be with you all the time. And whenever you need any help or any support, I will be here. So that regarding the dietary and lifestyle modification, I would definitely recommend that having like low carbohydrate diet, reduce the sugars in your diet. I'm not saying that totally cut down everything, but try to reduce these things: rice, white bread, sugars, and exercising 30 to 40 minutes 3 to 4 times a week would really help you. Just bring your fat content to a lower quantity as much as possible in your diet. And if you can manage your weight, that would really help your diabetes. So even by doing these little changes in your lifestyle, then it can bring your sugar levels very low. Are you with me?
Yeah, of course, doctor.
And there is one more thing I want to tell you, that these if you will be like coming for the regular visits, regular checkups, and with these dietary modification, I would definitely I can tell you that there will be very good changes in your blood sugar levels.
Right. Thank you very much. Yeah, now let me give you some feedback.
Oh my goodness, it was so bad.
And no, that's fine. Actually, you did better this card. But the thing, you're actually very confident. There is no problem. Second thing is you have subject knowledge. That is another thing. And you have spontaneity also. But I don't know why you are panicking. There's panic
So
clearly
it's my
exhibited.
one time, one first time, so I was
Yeah,
like,
no problem, dear. Don't worry. You're a doctor, okay? Remember that. Be like a tiger, okay? Don't be a cat,
mhm,
okay?
mhm,
So,
mhm.
right, you're doing fine. You're doing fine. Yeah, like many others, okay? Yeah, unlike many others, you're doing fine. No problem. The thing is that pauses and breaks and that uh, this
Mhm.
unnecessary sounds, you don't know what to speak, suddenly you have a problem with the beginning of the sentence, you have to rectify that one. Okay, so
Okay.
I am giving number of sentences, my assistant is also sending number of sentences in the group.
Sure.
Okay,
Sure.
so every time one card, okay, every time one card is there, see, I am just tagging that one in the medicine card. I'll give you, these are all my sentences, okay, which I have given in my previous sessions. See, for example, here, Dr. Priya Sharma, that is a letter. Then speaking, speaking, yeah, I'll give you, yes. See here, panic attacks. Okay.
Mhm.
So at Tariq, at Mahwish, right?
Okay, yeah.
MAH, yeah, yeah. Yeah, I tagged your name there. Okay. I tagged
Okay.
sentences which I gave. These sentences and many other sentences I'll be giving you. In OET Medicine May group, I have tagged your name. So you can check out there. And like that, you have to learn those sentences. If you have regular practice with these sentences, definitely you can do. Okay. Don't worry.
Okay.
Pauses and breaks. If you do some 10 to 12 speaking sessions, automatically you will be set right. Is that clear?
Yes, but I cannot open this classic corrections, panic attacks one. I don't know why.
Why? You are there in medicine group, right?
Yeah, I am there in medicine group, but I cannot like I'm clicking it, so it's not
Okay, you
opening.
joined late, na? Maybe before that one it came, I think. Wait, I'll resend that one. No worries.
Thank
I'll
you.
resend that one because that came after before you joined to the group.
Okay. Okay.
Okay, I'm resending to the group. OET batch medicine. Yeah, I sent it there again.
Oh
Okay.
yes, just got
Yeah,
it.
you
Yeah,
can watch that one. You can, there are many sentences like that one. Note all these sentences and try to practice. Okay, is this the first time that you are experiencing these panic attack? Did you experience such panic attacks earlier? So please add and tell me mainly about the following three things. First and foremost, what are the signs and symptoms that you have noticed? Secondly, the length of time the panic attacks lasted. And last but not the least, whether this is the very first time you experienced a panic attack or you had such attacks earlier. So many ways you can expand your vocabulary. I have given you the sentences. You can go through them. Yeah.
So
Now,
I have a question that do